Have you been told that surgery is your only option? Before you sign up for the operating room, check out this video where we're going to discuss how surgery does not solve your root problem. Before you drop all those comments below, I do understand that there are some people who would benefit from surgery and as soon as possible. In fact, we'll be talking about that towards the end of the video. But if you're watching this video and you have been told that you need surgery, please do listen until the end. We're going to discuss a lot of different things here and questions that you should consider and potentially even talk to your surgeon about before you schedule your surgery. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. And I have been getting a lot of questions in the clinic as well as YouTube comments of people saying, do I actually need surgery? Now, I understand that everybody's situation is unique. The name of my company is Physical Therapy for Everybody because every body is different. So today what we're going to discuss is definitely some questions that you should ask yourself as well as dealing with some common misconceptions regarding surgery. I can tell you personally, as a manual physical therapist, my recommendation is always to avoid surgery as long as possible, except for in a certain number of cases, which, as I said, we'll discuss at the end. I get it why you may be considering surgery. In general, there's two groups of people who are ready to sign up. The first group is one that is having an acute level of pain where the pain started recently, but it's really intense. Usually they're not able to walk, they're not able to sit, and they're definitely not sleeping. And when you're not sleeping correctly, your brain goes crazy, literally, right? It's difficult to have a complete thought and go through a complete thought process because you're not getting the sleep, which means your brain is not clearing out. You get that brain fog going on, and it's really difficult to be able to do anything else when you are in that much acute pain. The other group of people that I often see is people who have a chronic pain that has gone on for months and even years. And many of these people have tried everything in the book. They've done chiropractic, they've done physical therapy, they've done naturopathic solutions, they've done acupuncture, they've tried everything and nothing has worked for them. And that's why they've gotten to the point of saying, I need to have surgery because that's the only thing that's going to fix this. The challenge is that the surgery may address the pain generator, that is the structure that is actually causing the pain. However, it does not address what caused that structure to become painful in the first place. There's also a lot of cultural messaging. We believe our doctors, or maybe have a little bit of white coat syndrome where we just really get paralyzed when we walk into that room and we just trust that they have our best interests at heart and that they're telling us everything they can. And to be fair, they probably are telling you everything they can. But you need to understand a surgeon's perspective and lens on the world is that surgery fixes most things, right? You wouldn't be in their office if it wasn't somebody that you believed could help you and they believed that they could help you too. So for full transparency, my lens on the world is that I'm a manual physical therapist. I use hands-on techniques to help people heal holistically, and I have helped hundreds of people to successfully avoid surgery. So that's my lens on the world. The truth of the matter is that there is an astounding amount of research that shows for most issues, I'm talking about like total hip replacements, total knee replacements, low back surgeries, those are the most common orthopedic surgeries that happen. The success rate of surgery is about 50%. And to be fair, the success rate of all other techniques, including physical therapy, is about 50%. Now, most of the time in those research studies, they're looking at long-term outcomes. So they're looking 1 to 5 years down the road after either conservative treatment or surgery and looking at how many people are able to do the activities that they want to do and live pain-free. The thing is, if you have surgery, you are going to have some second order consequences. There is going to be some scar tissue. There is going to be some damage to the tissues that were cut through. And those often aren't addressed in a post-surgical rehab. Surgery treats the symptoms, but it doesn't treat the system. So let's go back to that total knee or that total hip replacement. So the reason why you have bone on bone or your cartilage is degenerated, or maybe even your femoral head, which is the head of the thigh bone, has changed shape. Yes, I have literally seen this happen via x-rays. So the surgery will fix the shape of your femoral head or deal with that bone-on-bone arthritis. However, it doesn't treat why your body got there in the first place. Arthritis is common, so people think it's normal. However, it's not how our bodies are designed, because the cartilage that lines the joint, which is the soft, squishy, spongy stuff that keeps the joint from slamming into each other, is designed to be able to heal itself as long as it's moving correctly. So if it's not moving correctly, then it can't heal, and that's when you get that arthritis buildup. If you have surgery on that hip, it will fix the joint, so it will deal with the arthritis. However, you still have the structural dysfunction or the postural issue or the lack of muscle control that caused it in the first place, which means you may still have pain. Plus, you also need to deal with the scar tissue and all of the tissues that were cut through in order to have that surgery performed, which can further exacerbate your hip symptoms in the first place. So if you ignore things like movement dysfunction, posture, strength, mobility, chances are good that you will still continue to deal with these after surgery or after the issue has gotten fixed. And of course, we do have to talk about the risks that come with surgery. Now, I understand that in the US, surgery is relatively safe. However, if you're opening up a body, there's always a chance for some risks. There could be an infection that happens. I have had many patients who struggled with infection of the prosthetic in the hip or knee when it was replaced. There could be nerve damage, potentially either from the positioning during the surgery or something that happened during the surgery. This isn't very common. Surgeons are very educated people. However, things can happen, and everybody's anatomy is just slightly different. And then, of course, there's the anesthesia risks. Now, they are way better about anesthesia, that they don't put you all the way under anymore. They just keep you in that sleepy state while they need to do the surgery. And they are much better about that. So those anesthesia risks have gone down overall. However, if you're already predisposed to have other issues or comorbidities, then that may be a bigger risk for you. Of course, there's going to be scar tissue and limited mobility after surgery, so that's something that you're going to have to work through to get back. Plus, if you lost mobility before surgery, now we've got to get all that mobility back too. And there is actually a thing called failed surgery syndrome. And what this is most commonly with low back surgeries, where they don't solve the problem that they went in to solve in the first place, which is usually pain. And the research is also super clear, particularly in regards to low backs, that if the surgery doesn't fix the issue the first time, each surgery that comes after has a decreased chance of actually working. And there's just the recovery time that happens after surgery. There's no way around that one. You've had the surgery and things have gotten changed, so you're going to have to recover from that. And for some people, that's can be a real issue. Other people are really concerned about having to take pain medication. Now, I will say, if you are having surgery, I am a proponent of taking your pain medication as recommended by your doctor, because I do believe that it's important to take that pain medication in order to be able to do your rehab and get your motion back. However, I know that people can be particularly concerned about becoming addicted to pain medication, especially if they have something in their past that leads them to believe that could be a problem, and can be a reason that people want to avoid surgery altogether. And if you do have surgery, or maybe you did have surgery, there's a lot of things that get overlooked in the rehab journey. There is definitely a lack of follow-up care or low quality follow-up care. In fact, in the Seattle, Washington area, more and more, surgeons are actually recommending that people can do online physical therapy because they can be taught to do their exercises at home. I have a huge problem with this because it is important to not only help patients be able to do the exercises that the surgeon has recommended. What surgeons are not understanding is the importance of having to walk into a physical therapy clinic. There's a lot of things that we see while you're walking, and we can have a conversation with you about how often are you doing your exercises. And when you're face to face, you tend to be a little bit more honest. So if you do have surgery, I do want to ask, make sure that you're having some in-person rehab. Now, initially that may be in your home at first while you're recovering, but then get into that outpatient physical therapy clinic so that you can get the care that you need and form that relationship with a physical therapist. Slight caveat for that, if you're in the Maple Valley, Washington area, I actually do not do post-surgical rehab. There are a number of reasons for it that I'm not going to go into in this video. However, feel free to give us a call and we will send you to our partner physical therapy clinics here in Maple Valley to make sure that you get the rehab you need. Now, to be fair, I will admit that physical therapy clinics are under a crunch as well, because insurance will drive their timelines and how long they say it's going to take for you to get better, which is also ridiculous because everybody is different. What we want is to be able to get you to the point of true healing, but that's not what your insurance company is concerned about. And the thing that I do actually see most in the clinic is people who have been emotionally disappointed because the surgery did not do what they thought it was going to do in the first place. And this is when people often come to me because they have had the surgery, it failed, they continue to have the pain, they cannot do the things that they want, they have been through the traditional rehab system and they have not gotten the results that they're looking for. And they need another option of someone who can actually help deal with this pain and get them back to doing what they love. So if I've convinced you that you don't actually need to have surgery or that there are other options available, let's talk about what those options are. First, you want to work with someone who is going to start with a thorough movement assessment. So you not only understand what the root cause of the pain is, because chances are good that you can tell me what the root cause is right now, but we want to understand why that area became painful in the first place. You want somebody who is going to treat the whole body. So we're talking about posture and alignment and strength, but not necessarily starting with strength. I have a lot of patients who come in who say, oh, I'm just weak and that's my problem and that's why I have all this pain. However, if your muscles are not coordinated and do not have endurance, you cannot be working on strengthening. I cannot tell you how many people come into my clinic and are just like, hey, give me some exercises so I can improve my strength, but their alignment is off. They are having way bigger issues than just strength to start with. And we have to start at the beginning. If you don't build that solid foundation at the beginning, you're not going to get the results that you're looking for. So I have to tell you a story about a patient who ended up in my clinic who was actually sent by her doctor right before she was going to be sent to an orthopedic surgeon for a surgical consult. So this doctor told her that she had to come see me twice a week for 6 weeks before he would give her a referral to see a surgeon. Now, when she came in here, she was pissed because she did not want physical therapy. She had failed the traditional physical therapy system and she did not want to be in here. She was convinced that there was no way I could keep her from surgery. And friends, I will tell you the truth. I wasn't sure I could either. Not because of anything that I found physically during the evaluation, but simply the matter that her psychology said that she needed surgery. So her issue was that she had a disc herniation at C6, C7, and she was getting numbness and tingling into her hand. It was actually into her left hand, and she was left hand dominant. And so it was affecting literally everything she was trying to do. Working, typing, cooking, and of course, she couldn't sleep on her left side at all. Even sleeping on her right side was difficult. She was literally a hot mess express. And the truth of the matter was, she was convinced. She told me to my face, there's no way you can help me, and I wish I wasn't here. So friends, I was not super optimistic, because if you don't think I can help you, then chances are good I can't help you. Again, our brains control our body. But I did understand the biomechanics of what was happening. She had a disc herniation that we needed to heal, so it would decrease the pressure on the nerves, so she would stop having the symptoms in her arm. Really, it's pretty simple from a biomechanical point of view. So we set about doing that. And after 6 weeks, which was a total of 12 visits for her, she actually didn't need the surgery. She didn't want the surgery. She was shocked about what had happened, but she was able to continue on with her life doing everything she wanted to do pain-free. And I remember when she walked out, she actually told me, I never thought you were going to be able to help me, but let me tell you, if these symptoms ever come back, I will call you immediately. And friends, I'm happy to say I have not heard from her for the past 4 years. Now, I did say I would talk about when surgery might be necessary, and there are times when you need to not pass go and head straight for surgery. So if you have a true displaced fracture, yeah, that's going to be a surgical consult. If you have severe trauma and you are bleeding all over the place, yeah, that's going to be surgery. If you are having difficulty controlling your bowels and bladder, and by that, not just it's hard to make it to the bathroom, but I literally have no control, you need to check in with a surgeon right now. And the other thing that I will say is that if you have a bony malformation that's seen on X-ray, chances are good that this cannot be fixed with physical therapy anymore. Once the bones start changing shape, that tells me that this issue has probably been going on for years and is not going to be something that we can correct with physical therapy. Another reason why people might be seeking surgery is when they have been consulting with people that they think can help them and trying the conservative method, but this has been going on for years and it continues getting worse. There does come to a point, and for me, it is particularly when we lose bowel and bladder function or when you start to lose true strength. Not just I'm getting weaker because I haven't worked out for a long time, but like I can't walk because my legs regularly give out on me. Those people are just surgical consults at this point because things have gotten too far and it's going to be hard to get you back over that edge. If you have decided to have surgery, let me caution you, you do want to make sure that you have done prehab, which is rehabilitation that you do before surgery to set you up for success. The better your mobility, the better your coordination, endurance, and strength, the better your postural alignment, the better your walking, and all of those things, the better you're going to come out on the other end of surgery. So the more you can do beforehand, the better you'll be afterwards. The other thing is you want to make sure that you're getting the right surgery for you. I had a friend who was getting a total hip replacement, and I happened to ask him if his surgeon was going to do a posterior approach where they went in from the back or an anterior approach where they came in from the front. And he said, oh yeah, my surgeon's doing the posterior approach because that's the one that has the research and it's way better. He told me that people might tell me I should have the anterior approach, but he said, no, the posterior approach is the one that has all the research. What I can tell you is the posterior approach is the one that's been around forever, and so it does have more research. However, the anterior approach research clearly indicates that this is a better surgery, and it significantly decreases the risk of having that joint pop out in the long term. The thing is, surgeons don't want to go back to school to learn the anterior approach because obviously it's different than the posterior approach. So if your surgeon is recommending a total hip replacement, please make sure that they're doing an anterior approach. And if they're not, you may have some really specific situation that the anterior approach is not the best for you, but make sure that they explain that to you and why it's not the best approach for you. Here's the things that I really hope that you take away from this video. First off, your body is designed to heal itself as long as it's moving correctly. When your body is given the right tools, many things can actually heal on their own without surgery. Number two is that it's important to empower yourself with knowledge and holistic care. It's much easier now to find information online, and I encourage you to do your research and ask your doctor good questions. Not trying to tell them Dr. Google says this or Dr. Google says that. Don't do that. But if you have some legitimate questions, for instance, with a hip approach, why are you doing a posterior as opposed to an anterior approach? I feel like that's a very reasonable question that you should get answered. And friends, the most important point I want you to take away from this video is you are not broken. You're just missing the right path to healing. If you're looking at surgery or been told by a doctor that surgery is your only option, let's talk first. If you're in the Maple Valley, Washington community, I'd love to offer you a free discovery visit where we can come in and hear your journey and discuss what the best option for your body is. If you're not in the local community, we do offer online health coaching, and it would be great to sit down again and hear your story and help give you some ideas on what your next best step is. And if you've ever wondered what the difference is between manual physical therapy and the traditional physical therapy approach, I'm going to have you check out this video over here.